But we need to draw a line, because AI is not a magic tool. It's not going to solve everything. And we need to know when AI can help and when we actually need human intervention. So just before we start, did any of you use any AI tools recently? Any ChatGPT, Alexa or Siri? Raise your hands. Okay, quite a few. So we see that AI is everywhere, and it's not going to stop. And especially AI making really big difference in healthcare. And as we mentioned, AI can help with diagnostic, making more precise triage as well, and helping provide better service. And at MindTales, we use AI to help people to deal with stress, anxiety, and other issues. And we're using AI chat 24/7 support. And especially for younger people, it really provides them a tool which is stigma-free, available when they want it, and it really helps them to deal with this. Even if you think about the research, 60% of younger population actually prefers text-based support than face-to-face. But we need to draw a line, because AI is not a magic tool. It's not going to solve everything. And we need to know when AI can help and when we actually need human intervention. And especially in those situations when it's real big issue or trauma, so then you need psychologists and psychiatrists. So that's why in MindTales we provide full stack solution. We provide AI support and then access to wellness coaches, psychologists and psychiatrists. AI is really good at helping you to provide like coping mechanisms and seeing like mood check-ins and stuff like that. But as I mentioned, configuration with AI and human, it really makes a difference. So both together, it's really what makes healthcare effective. And now, if we move to wearables, I think a lot of people now wearing wearables, and now going forward, they become even smarter. It actually allows us to move to preventative, to reactive care when we solve the problems after they have happened, to preventative care. Because now a smartwatch, I'm not sure like how many of you wearing them, then actually like my Garmin can tell me if I'm feeling stress, so just ask me to take a breather. Like a few years ago, it was like from science fiction, but now actually it's happening. And when we merge wearables with AI, we can actually create very personalized wellness tools, depending on what you want at that point in time. And it's no longer about data collection, it's all about actionable insights. And now, if we move to telehealth. So actually, how many of you tried virtual doctor's appointment? Raise your hands. Or you know any of your friends? I see a few hands. So actually, before COVID, it was really like, not taboo, but healthcare was really slow to adapt to the changes. And once COVID happened, everyone moved to online. And it's actually a real game changer. Now you can talk to the doctor anywhere in the world. It saves time, cost, and as well is very convenient and important for those people in rural areas to access the healthcare they need. So now if we look at the telehealth, AI, and wearables, we can see now the system which really changed healthcare. So now your doctor can access your wearable data, sleep patterns, stress, even blood oxygen level and other biomarkers before you even say the word. So now everything will become more personalized. And if we look at this from the medical and wellness tourism, we see how it's changing medical tourism. So now before you even travel to different country, you can have consultation online. And it really makes less stress, better outcomes, and at the same time when you leave the treatment, you can have this continuation of the care. And if we look at the wellness tourism, it's similar, like the data from the smartware, it can really make tailored treatments. So every day you can have different treatment depending on your stress level, how much you slept, and it really changes the experience. So instead of a vacation, you have now truly transformative experience. So now when we think about all those things, it's really changing how people access the care and make it more accessible. And we all have a role to play. As it lowering the standard, would it be social, economic, or geographic, we as a patients need to take charge of our health. So get those smartwatches, get the data, understand what it says about you. And at the same time, healthcare providers, now they can use those tools to make care more personalized. And for innovators and entrepreneurs, it provides immense opportunity to create tools that really effective, working, and truly game-changing. So I invite everyone to embrace in this journey and just make wellness and mental health more accessible to all. So let me know if you have any questions. Thank you.
I just want to ask about the radiation impact on the health when we are going to use the electronics, the smartwatches.
So I think radiation is the same as with the phones. So I think the technology is really changing. So now it's not the same impact that it was like 10, 15 years ago. So now we have a lot of medical data and research done before you can use the watches or smartwatches. And when you say about radiation, so it really depends on the wearable, what kind of data it captures. So for example, Garmin, it gets infrared light, so then it's radiation, it's really minimal. So if we look at the Apple Watch as well, I'm sorry. So now I think wearables really, they don't make before the testing, and everything is really in the safe side. Because when my previous startup, I was doing IoT device, so I was measuring bioimpedance. So bioimpedance is the electrical signals going through your body, and then they measure how much like body hydration you have. At the same time, we stopped because we saw that this is not great for the people. So when actually like anyone who doing like those wearables, they have to go through the rigorous test in order to finalize the prototype and then commercialize the product.